There's no thrill like discovery. The Discovery Channel. Explore your world.
Dr. Steven Rosenberg declared war on cancer almost 30 years ago. In 1996, he began clinical trials for a new kind of treatment.
A lot of things are happening. And the really thrilling part of it is they're not only happening in the laboratory, we're actually seeing tumors disappear in patients. So we're on the track of something. You know, we've been this close before, and so exactly how it's going to evolve from now, we really cannot tell.
The patients in Dr. Rosenberg's trial have skin cancer or melanoma, one of the deadliest and most aggressive forms of cancer.
Wow, look at this one. This was the largest one that we had. It looks like it's smaller. Hi there, and this is Marie, right? Hi, Maria. How are you? I'm Dr. Rosenberg.
Almost 2 years into the trial, a striking number of patients have seen their cancer shrink dramatically.
Does it look like they're still fading?
Yeah, they're fading more.
Wow, now this is spectacular. This is really spectacular. You can see there are little islands of tumor cells, but the lymphocytes are beating them back.
As Rosenberg moves into the final months of his experimental trials, he may be closing in on a major new weapon in the treatment of cancer. What Dr. Rosenberg has developed is a cancer vaccine. It's an immunotherapy, which means it stimulates the body's own immune system to recognize and attack the cancer.
Sydney! Welcome back.
Unlike other vaccines, this one is given to patients who are already sick, like construction worker Sidney Wheat.
Tell me how you've been doing.
Been doing fine.
Tell me what's happened to these, and we'll take a look at them.
They shrunk.
They shrunk?
I believe so. Remember how they used to stick out?
Uh-huh.
This one here, it doesn't, and the one that was right back here.
Wheat is the
flat.
first patient to try out Rosenberg's latest vaccine treatment.
That's very exciting. Well, let's take a look. You've always been pretty optimistic, and we don't always agree with what you say, with your evaluation, but let's give it a shot this time and see what we think.
My ear's gotten smaller also.
Has that gotten smaller?
Yeah.
Okay, good. Let's take this off if we can.
Through 2 years of experimental treatment, Wheat's melanoma has continued to spread.
Okay, it's getting to be that kind of weather.
Now he's received 2 doses of the new therapy.
Okay. Actually, you're right. These are much less confluent than they were. Much less, I think. Because these were almost a continuous band before. I think you're right. I think for the first time we are seeing some shrinkage of these things. You're always the eternal optimist, which I like. Yeah. I'm an optimist myself, but this time I think the facts are backing you up. So we've seen in the last month some very interesting clues. Now, I don't want to get too enthusiastic about it because it's still a very small number of patients, and you can get fooled by small numbers. But it's a clue. And when we get a clue like this, we go after it as rapidly as we can.
To date, Dr. Rosenberg has treated some 2,000 advanced cancer patients with earlier experimental treatments. He is convinced the key to curing cancer is locked within our own bodies.
There are unique things about the immune system. It has an exquisite specificity of recognition that doesn't exist for any other kind of treatment. When we use surgery or radiation therapy or chemotherapy, we're destroying normal cells as well as cancer cells because they can't distinguish between the two. But the immune system can. It can distinguish a single molecule that's different on a cancer cell than a normal cell.
The first evidence that he might be on the right track came 10 years ago, when Dr. Rosenberg discovered that a hormone called interleukin-2, or IL-2, could make cancer disappear in 17% of patients. The hormone boosted the number of the body's immune cells, which can destroy cancer.
Prior to our development of the interleukin-2 based treatments, essentially no one with metastatic melanoma survived. Very rarely did patients survive beyond 2 years, and almost none survived at 5 years.
It took another 2 years to discover which kind of immune cells were doing battle with the cancer.
These are the immune white blood cells, the lymphocytes, that we're trying to activate by our vaccines. And as you can see in these remarkable images that are actually taking place in culture, the lymphocytes attacking the tumor. And as it attacks and attaches to the tumor, we see these projections in the tumor cell which indicate that it's being destroyed, its membrane is being dissolved. It's actually a physical battle taking place within our bodies.
Okay, any chest pain, chest pressure?
The Food and Drug Administration will allow up to 50 patients to join this latest trial.
What about the legs?
Dr. Donald Weber, a college dean from Ohio, is one of them. All conventional cancer treatments have failed him.
I feel in very safe hands right now, and if I have a shot to live, this is the best shot I'm going to have. But on the other hand, I'm a research subject, so it's with mixed blessings that I proceed from this point.
Donald Weber's cancer has spread to his lungs. Most patients like him would survive less than 6 months.
The reality is I've not yet felt a symptom from the melanoma yet. I know it's spreading inside of me.
Yeah.
Okay, so let's see what we're dealing with. That's a definite 3, right? A definite 4, definite 5. That's a maybe. It's a big one. So at least 6 definite lung nodules and probably a lot of other smaller ones. Whoever? Good, please stay right where you are. So we just had a look at all the x-rays. And they look a little bit, we can see a little bit of growth compared to the x-ray we saw at the beginning of November. But there's not much there. The reason that the doctors suggested you come here is that we've been developing new approaches to treating cancer that involve a different kind of approach than the kind of chemotherapy or surgery you've received. We're developing treatments that stimulate the body's immune system so that the body itself can eliminate the disease. And so you'll be getting 2 things. The peptide immunization, which is very experimental and not proven to be of value, although we can measure changes in the blood. But also you'll be getting high-dose interleukin-2, which we know in and of itself can cause tumors to go away in some patients, and we have a vast experience with that.
So just guarantee it'll work, but you can't do that anyway.
I wish we could.
No, I'm feeling comfortable right now, so.
Okay.
Right there.
First, Donald Weber will receive a single injection of the new peptide vaccine, followed by a course of IL-2. Although our immune system is capable of fighting cancer, it's a mystery why it fails to recognize the disease as a killer and does not attack it. If Rosenberg and his team could find out why, maybe they could teach the immune system to see the tumor and destroy it. They searched inside the cancer's DNA and in 1993 made a landmark discovery, vital to the immune system's recognition of the cancer. Then they identified a section of that gene that makes a peptide, which is present on the surface of the cancer cell. They used this peptide to create the vaccine. It enables the immune cells, the lymphocytes, to recognize the killer. They seek out and destroy all cells displaying the cancer peptide like a missile locking onto a target. A microscopic war is underway, except that it doesn't work in all patients. 17-year-old high school student Tina McDaniel became a patient at the NIH in 1996 after extensive chemotherapy failed to cure her melanoma. She's been through 2 earlier vaccine trials. Neither of them worked. Rosenberg then tried extracting lymphocytes from her body, growing them in huge numbers in the lab, and then returning them to her. After this trial, Tina's tumors finally started to shrink.
The first 2 weeks, it started shrinking like a lot, like 3 or 4 of them. And then like about the 4th or 5th week, they kind of grew back a little bit.
This tantalizing hint that Tina's immune system could attack her cancer didn't last. Her cancer has now spread to her left leg.
Oh yeah, I think it's a lot worse.
Yes, without a doubt.
Wow.
So that's her proximal lesion.
That thing I mean, she's going to fracture right through that.
Right.
All right. So a lot of progression in that. It's actually quite remarkable that can support any weight at all. I mean, she has almost complete destruction of the bone.
Dr. Rosenberg decides to switch Tina to the promising new combination of peptide vaccine and IL-2.
She's had chemotherapy, she's had alpha-nephrin, high-dose IL-2, our vaccines. There's really nothing else that we'll be able to do. So we'll just be pretty vigorous here. Hopefully she'll be able to tolerate it.
Tina has had her vaccine and just received her first dose of the immune booster IL-2.
Hi there.
The vaccine has no uncomfortable side effects, but the same can't be said for IL-2.
Tina's not a morning person. Has she been nauseated this morning? Okay. Well, you know, we're most enthusiastic about these immunizations with the peptide and IL-2. We've seen a few patients now that have had very dramatic decrease of their tumors with what Tina is getting, so I'm not going to try to engage Tina in any major conversation this morning, no.
Not a morning person.
Okay, is she staying off the leg? That's real important given the fact that it is weakened by the tumor. Okay, how are you doing?
Oh.
All right, good.
Donald Weber has also started his IL-2 drip treatment. Symptoms like chills and fluid gain are frightening and unpleasant side effects.
You got his first doses?
Got his first dose.
Good morning, Dr. Weber. Hi. Good. Well, we're off and running. Get some sleep last night?
Pardon?
Get some sleep last night?
Yes.
Okay. If you have any side effects, you let us know.
Okay.
We'll do our best to take care of them.
Okay.
All right, good.
Good morning.
It's not known how many genes are involved in the immune response to melanoma, but Rosenberg's team has just found gene number 9.
This is a laboratory in which all of the gene discovery has taken place. Yutaka and Paul and the team have been working for years to find these genes, and in fact, Yutaka's been searching for this new gene now for almost 2 years and has just found it in the last month or two. We're just now trying to understand how it's expressed, in what cells it's expressed, identify the small fragments that are the peptides that are recognized, and that scientific process will take several months. Then it could potentially be something we use in treatment in maybe perhaps a year.
As more and more of melanoma's genetic makeup is understood, the chances of making a vaccine that will work for all melanoma patients get closer. Sidney Wheat is back for his 4th round of treatment. He hates flying and drives up every 3 weeks from New Orleans to the NIH.
I consider myself very lucky. Number 1, to be up here. Number 2, for the treatment to be working on me. I feel guilty at times about it, to be honest with you. You always wonder why me and you know, and not the other person. What's the difference? Why?
My God, it's amazing how this is clearing up, isn't
Yeah.
it? But you got these up here. All of these have completely flattened out. My guess is we would see no tumor in any of these now. I think we still have some tumor here, but you see, if you run your finger over it and don't feel anything, then that's an indication that there's probably no tumor left in there.
There were 80% tumor destruction on the pre-4th cycle.
Right.
I've got one other little problem.
Yeah, what's that?
They told me at work Friday that unless y'all can say that I won't need any more treatments, they're gonna fire me.
Oh dear, really? Oh Lord, we're gonna have to talk about that.
Told them they could just take it and.
We'll have to talk about that.
Well,
really? Are they allowed to do that for an illness?
But I told them I'm gonna do what I gotta do.
You gotta get rid of this tumor, that's for sure, right? But I think we got it on the run now, don't we? We'll see you upstairs this afternoon.
80% destruction of active melanoma is a remarkable result. In some of Sidney's lesions, there is now no cancer at all. Most melanoma patients whose cancer has spread will be dead within 1 year.
Okay, I had some good news today. Well, you remember the 2 they cut out of my head? I told you they were only, they come back and 80% destroyed. All right, the one they cut out of my neck the day before I left, it come back. It's no longer melanoma.
Fantastic.
All right, Tina, you all set? Taking a shower?
Tina McDaniel has come to the end of her IL-2 treatment.
Okay, and you're getting around with these. You're not putting any weight in that, are you? Okay. You know what I want to do before you go home is just re-educate my fingers about what these feel like, because not only the size, but the consistency is important, and that'll help us decide what we need to do next time you come here, okay? Good. So let me just take a feel. Let's just run me through each of the lesions that you have now. Let's see this one. Now, this is the one that has gotten the biggest, right?
Mm-hmm.
Okay. Now, is that hurting you at all?
No.
Let me just undo this there. Okay, that's perfect. Yeah, that's increased quite a bit since we started. But maybe just lie back so I can feel the ones behind your knee. Could you do that? Good, careful with that. Good. Now you have one behind each knee. I feel this one here. Is that one growing? Yeah, this one feels a little bit. Just bend this knee up a little bit if you can.
When she walks, I can see it now, where before it wasn't noticeable.
Okay, and how about on this side? Good. Okay, well, we're real enthusiastic about this last boost, because with the immune system, what you have to do is you have to keep boosting it. And we've given you a good go this time. We'll see you back in 2.5 weeks. Get a complete set of x-rays again, and then decide. Let's have a good trip home. Okay, good. All right, I'll see you back here in 2.5 weeks.
Okay.
Keep in touch.
You'll hear from us.
Okay, good.
It took Rosenberg 8 months to get permission for the clinical trial that Tina is now on.
Okay. Now what I've done, every time you write a protocol, there are multiple review groups that have to review it, and that takes time. We have to get our own internal group to agree upon it, and although everybody's agreeable, we don't always agree on what needs to be done. That then has to go to protocol review and monitoring boards to be sure it has a high enough priority to be done here. And then it has to go to our investigational review board to be sure it's ethical. And then it needs to go to the Food and Drug Administration to be sure that the new drugs that you're using are safe to administer. And so we deal with a very lengthy process. I wish there was some way to compress it, because from the time we start writing a protocol to the time we actually get to do it, tens of thousands of cancer patients have died. It provides a real sense of urgency to move things along quickly.
What are you going to do when you get home?
No idea, be bored, probably. It's my friend's birthday today, but I'm not gonna get to go. She better save me some cake.
So what's the plan? Coming back in 3 weeks?
And yeah, on the 23rd, coming back. I don't know what we're gonna do though.
Donald Weber has now received 2 courses of the peptide and IL-2 treatment.
This is always a nerve-wracking walk to see the x-rays, never knowing what has actually happened in the interim. Not nearly as nerve-wracking, of course, as it is for the patient. In Mr. Weber's case, virtually all his disease is inside his lung, and he would have no way to know at this point whether or not they were shrinking. Okay. Well, he's got several small nodules in his lung. And this one here, as we work our way down, this one here has now shrunk to this size here. You can really barely see it. So that's actually quite interesting. Wow, look at this one. This was the largest one that he had. And again, it looks like it's smaller. Okay, well, Dr. Weber, all good news. All good news. We're actually quite thrilled to look at the x-rays. We see, as you know, there are several of these lesions that we're following in the lung, and they all look a little smaller. Yeah, they all look a little smaller. They're not gone, but we saw them shrink, and some of them continuing to shrink. The major shrinkage was after the 2 cycles of the vaccine with IL-2, and now some of them are even a little smaller now. So it looks like we have these on the run, and we got to keep going.
That's wonderful.
So we're very excited about this.
We are very excited.
The dangerous ones, the ones we can take out, the half a dozen or so that are in the lung, are all getting smaller.
Wonderful.
So it's really it's very exciting to us. So we're going to go ahead and get started again today. Give you the injection up here and then send you on back to the floor to get started tomorrow. If you want to go out tonight and have something to eat, that's fine.
Yes, we can celebrate.
All right, that's great. Good. Okay. Well,
thank you again.
Sure enough.
Appreciate that.
Righto.
Thank you very much.
Righto. This is really good news for Mr. Weber, obviously, but we may finally be hitting on the right combination of immune stimulants with this vaccine that are required to stimulate an appropriate immune response. But you know, we've been this close before, and so exactly how it's going to evolve from now, we really cannot tell. And what we need to do is treat additional patients. Is Mr. Thomas here?
Another patient under consideration for the trial is rancher Elton Thomas from Texas. He had a malignant mole removed in 1990. 6 years later, lumps started appearing on his skin. He's now been diagnosed with advanced melanoma.
When did that first develop?
Probably about 7 months ago.
7 months ago. And has it been still growing the last month or two?
Well, it seems to stop growing now.
Is it painful?
Yeah, it hurts. This part of it does.
Just show me all the nodules you have. You have these ones up here.
One there, got one back here.
Sure. One here.
One right there.
Yeah.
One right here.
I see. So when were all of these coming up? All within the last several months?
All of them came up within the last 3 months, except this one.
I see.
And these two.
I see. Now tell me about the smoking. When did you start smoking?
When I was 14.
And
I'm 58.
Smokers cannot safely tolerate IL-2, so Rosenberg decides to give Elton Thomas a new immune system booster.
We know the peptide alone as a vaccine is not enough. We need to give something that will enhance it. Now, the strongest enhancer we think we have is interleukin-2. And that's what we're giving to most of our patients. But Mr. Thomas is a pretty tough fella and has lived a pretty hard kind of life. He's a 4-pack-a-day smoker for about 40 years. And that causes enough changes in the lungs, so we couldn't give him the IL-2. The IL-2 causes too many changes in the lungs, and if you're a heavy smoker, you just can't tolerate it. It's too dangerous. So we had to drop back and give him a different kind of immune enhancer called GM-CSF.
Unlike IL-2, GM-CSF can be self-administered. It has minimal side effects, but when given alone, has no known anti-cancer activity. Elton Thomas will be amongst the first to try it.
Nothing to that.
Tina McDaniel's cancer is progressing. She was forced to stop the vaccine therapy 2 months ago so that she could have radiation to control her pain. She is back to resume treatment.
This time I think they're just going to give her the vaccine, and she's got a couple of tumors, small ones that are hurting, that they talked about taking off, just for her comfort. But they'll decide. They said they had to see him before they could make any decisions on it. She's real optimistic.
Okay, so to summarize with Tina, we're in a very difficult situation. As we suspected, her disease has progressed. She's been getting radiation therapy to try to shrink down the large lesion in her neck and relieve the pain in her leg. And the neck mass we know about, we can feel, but we see it on X-ray, but I'm hoping that'll start shrinking. And then devastating destruction of the bone in her lower leg. It started here, and you can see the normal contour of the cortex of the tibia, and now you can see it exploded by growing tumor inside the bone. Hi there. Hi. Good to see you. Hi, Tina. It's nice to have you back here. Got in yesterday? Mm-hmm. Did you? Good. A little tired from the trip? Can you sit up? Is that all right? Good. Now, Tina, tell me how you did during the, since I saw you last, during the radiation treatments. Did it cause you much in the way of symptoms? The radiation treatments?
The skin here is
What's
like
that?
tight. It hurts. The skin.
The skin is, yeah. That's due to the radiation, and that'll soften up some. So did you have any symptoms during the radiation, nausea or any problems with that? No? Okay. Did it make you real tired? No. Okay. Do you sleep a lot during the day? What is your normal day like? Are you up and around? I know Tina's always been a sleeper. Even during her treatment, Tina's one of the few people who can actually sleep through IL-2 treatments, which has always astonished us. That's a good talent to have, isn't it? So the question is how to proceed. The vaccines that you've gotten have caused dramatic shrinkage in some other patients, but not in you yet. And so what I want to do now is resume the vaccine treatment, but this time we're going to distribute it in several areas. So it's going to be a few tiny little sticks with a needle. It'll be a little more, but it'll all be over in seconds.
Listen, I wanted to put in the request for the vaccines for Tina.
I'll tell you what I'm going to do before I do it. First thing, what we're doing is we're injecting a lot of different spots to get as many different areas of the lymph nodes immunized as possible. We think this is going to help make a difference also.
I don't think the disease has her beat yet.
Oh, no.
This time, Rosenberg modifies her treatment. Tina will receive only the vaccine and no IL-2. Studies in the lab show that delaying IL-2 may enable the body to build up more immune cells and make it more effective. It's day 3 of Donald Weber's IL-2 treatment.
Hi, Dr. Weber.
He's received 8 doses.
Well, we really rocked you with this, didn't we? Yeah. But it's all done, and you took a lot of treatment, and we're very pleased with how you took it. I know it was hard on you, but things seem to be settling down. The diarrhea a little better?
I think so.
Okay, are you real thirsty?
Yeah.
Okay, we just took you off liquids and food. We're going to put you back on that now, so we'll start them on a soft salad diet. I know you feel real tired. Anything else bothering you? Or aches or pains? Or?
No, not really.
Okay.
I'm still rocking
A little rocky. Okay, you know the IL-2 will cause that, but it all comes back to normal. Important thing to realize, everything we gave you is a natural body substance. You didn't get any foreign things like chemotherapy, so it's all natural, and as it wears off, everything will come right back to baseline. Okay, well, we're pleased with how you're doing. We just want you to rest up today and tomorrow, and we'll shoot for getting you home in the next few days.
Okay, that sounds good.
Good. Okay. Good. Rest up. Sure enough.
Donald Weber is not the only one responding to the peptide and IL-2 trial. Single mother Jacinta Cohen is back for assessment.
Okay, so let's, Jacinta Cohen's in clinic today, and let's hear about her.
Okay, Ms. Cohen's a 42-year-old woman with extensive melanoma from a right flank primary to multiple cutaneous and subcutaneous sites and liver.
So she's failed aggressive chemotherapy, in fact had a lot of toxicity from that chemotherapy. Had growth after the first cycle, but now after the third cycle for the first time starting to show us
it's pretty dramatic.
Some decreases. Let's go take a look at her. Well, please sit up here. And
Hop up here. Okay.
Thank you for coming down here. Did you fly in today?
Yes, just this morning.
Okay, and your daughter, how old's your daughter?
12.
12, and she's taken care of?
Oh yeah, she's
going
in
to school? Is she? Okay. Well, let's take a look at these. What I'd like to do is just sort of go over top to bottom and see how we're doing. We have them documented with photographs, but these were all much more protuberant, were they not? Have people you know been remarking about these changing? Is
Yeah.
Really?
They have, yeah.
Your daughter?
She's the first.
Is that right? What is she saying?
Oh, she noticed it right off the bat, and I kept making her be calm until you said they look smaller.
Is that right? Well, they look smaller. There's no question about that. Now, let me hear about these ones in the eyelid. They were actually quite lumpy, weren't they?
The one in the corner was lumpy.
Yes. Yeah.
It definitely
we have
was.
photographs of that?
Yeah.
and the other eye has the same.
And then there's a scleral.
Yeah, I had one on the
look
white.
down if you would, I see, and that was actually quite lumpy as well. Let's just see the rest now. Let's just take a look at that.
There is a direct link between sun exposure and melanoma. Fair-skinned people are especially vulnerable. Jacintha Cohen never wore sunscreen.
Probably as well, but it looks like all of these are much flatter, Miss Cohen. This is quite remarkable. We're thrilled to see this happen. I know you are. I mean, you must be thrilled. She's showing a stunning regression of these. I think these have even changed in the week since we stopped her treatment. So they look even lighter than they did, than they did before.
It really, with that third cycle, things move very quickly.
Things are happening with this peptide vaccine that we weren't seeing before. But we'll see. It's very exciting in one sense, but at the same time, you have to temper that with the fact that it's still very early and you can get fooled by small numbers of patients. But so far, very dramatic.
Also back for assessment is the patient Elton Thomas, who tried the new immune system booster.
Our measurements, and we can take a look at them right over here, 7 lesions disappear. He's had 16 lesions decrease in size and only 4 increase in size.
Okay, let's take a look at him. It's exciting. So he's the first patient that we've given the 209-2M peptide plus GM that's actually responded. What's happened to them? They just go away? Do they get red, or what actually goes on?
They get red and irritated. And then...
when you say red, you mean the skin over them gets a little red?
Gets real red. And then the skin right above them gets real dry and chaffy. And it itches. You want to scratch it all the time.
All right. And then they start shrinking. And some disappear.
Right.
That's terrific. Do you have any that are red now?
Oh, yeah, I got that one.
Now this one, boy, that is a lot smaller than it was, isn't it?
It's about half the size.
It's about half the size. This one, when we first saw it, was much larger. Any others that have gotten red?
Yeah, I've got, well, this one over here that you cut
The one
out.
we took off. Yeah, let's take a look and see how that's doing. That was one that was in the process of disappearing, and so we wanted to get a good idea what it would be like. Now here's a good example.
Now see, this one here.
Now you had a lump there before.
Right, and it's gone.
But I don't feel anything now.
That was
But it's still red.
That was 1.5 centimeters 3 weeks ago.
Really? So that one was half an inch or bigger. So I see it forms this area of inflammation. Mario, have you seen this? The kind of response we're seeing in Mr. Thomas is in some sense a lot more important than a lot of the other ones we've seen. IL-2 itself has some anti-tumor effect, and we have to work hard to distinguish between the vaccine and the IL-2. GM-CSF that Mr. Thomas is getting has no anti-cancer effect itself, so we know the peptide vaccine is doing it. So he presents very dramatic evidence, like a few other patients, that the peptide vaccine itself can be very potent. It gives us a start, a jump on stimulating the immune system, and what we now need to do is figure out how to boost that. GM-CSF may be part of the answer, IL-2 may be part, maybe the combination will be a part, but at least it gives us something to work with.
To find out what's going on inside Elton Thomas's body, Dr. Rosenberg removes one of his shrinking tumors.
Good of you to let us do this, because it's going to teach us a lot about what we need to do.
See, if y'all had waited another week, that one would have been gone.
Would have been gone. I know. You see, one of the things we're really interested in seeing is what's making it go away. So if we could understand that, it'll help us figure out how to make it go away in other patients as well. So, all done. That's wonderful.
The biopsy is examined in the pathology lab.
And the first thing that we should take into account here is the fact that the blood vessels, even in the tissue that doesn't have the tumor, which you're looking at here, shows this remarkable proliferation of new blood vessels.
The large white oval areas are cross-sections of the new blood vessels that have formed to carry the smaller dark blue lymphocytes to the cancer.
Now, how unusual is this?
We never see this.
Is that right? Okay, so this presumably is due to this vaccine and GM. Wow, now this is spectacular. This is really spectacular. So all those clumps of tumor are now surrounded by some lymphocytes, right? You can see now complete disruption of the tumor. I mean, there are little islands of tumor cells, but the lymphocytes are beating them back. And he was telling us it was going to go away if we just left them alone. And it's not our style.
Tina McDaniel has received 2 peptide vaccine treatments injected at multiple sites, but her tumors are continuing to grow. The team must decide whether she can tolerate more treatment.
You know, she looks a little more frail, and she's obviously lost weight since we started. I want to talk with her about, and her family about taking more IL-2 now. I think the chances it can help are slim, very slim. I think there's some risk to giving her IL-2, but she's had every chemotherapy possible. She's had all the best vaccines we think we have. She's had a lot of IL-2. I think there's really nothing left. It's a particularly vicious kind of melanoma. These lesions will start to ulcerate on her breast, on her back, on her arm. It's going to be very evil. But I think she can tolerate and survive a course of IL-2. And if she shows us any evidence of change, we could keep going. And if she doesn't, I think we would stop at that point. Hi there.
Tina is starting her senior year in high school. Before she begins treatment, she wants her neck tumor removed for her yearbook photo.
The problem is it would be a big operation to do that. It's not impossible, but it would delay everything else we want to do. I understand why you want it done. I have a young daughter myself. Does the picture have to be taken on the 14th? Can it be delayed?
Well, there's some other options we can look at. But they said they thought maybe on the computer they could remove it.
As a matter of fact, that is the case. That can be done. It can be done. Tina, the goal is to get rid of not only that thing on your neck, but everything everywhere else as well. It is, of course, difficult to take care of patients with advanced cancer. It's what makes it so hard to ever leave here. And in fact, in some part of my mind, I never do. How can you leave patients who are suffering and dying from their cancers and go home and play checkers with your children? And it's a very difficult thing to do. One of the things that keep me going, at least, and keeps people working in the laboratory day and night on developing these approaches is the hope that someday we can do better.
Have you been scanned before?
Oh, yes.
The last time you were here?
It's Donald Weber's 5th visit to the National Cancer Institute. His lung tumors have nearly disappeared, but on a routine brain scan, there's a surprise.
I got a call from Jan with some terrible news. It looks like Dr. Weber may have a brain metastasis on his scan this morning, which is very unexpected. He has had no symptoms from it. Yeah, there it is. No, gotta go.
Yeah,
gotta go down.
I got the next cut here.
When we go back to the very original films, there's a little dot there that was called normal that might have been that lesion, too small to call back then, but it changes everything because we've got to deal with this. This could potentially be a life-threatening problem. Dr. Weber. Way back. How are you doing this morning?
Yeah.
Okay. We've checked over the brain x-rays, and we have a finding on the brain x-ray that's unexpected. There is a lesion that is new that we hadn't seen before. These are x-rays that came out this morning and we looked at. Not causing any symptoms, and there's only one there, but it is new and it has grown. And it looks like it's the melanoma. I can't imagine what else it might be. Now, it's a solitary lesion, and we have many patients that have lesions in the brain that we've removed that have had no symptoms from it and have gone on for very long-term survival. We have some patients now out beyond 5 years appear to be cured. Hopefully we can remove this promptly and then leave you, hopefully, tumor-free, and we may then resume just the peptide immunizations. So I'm sorry to have to give you this news. I'm sure it's a shock, but it's not as if there's nothing we can do about it. There's a lot we can do about it. All right, we'll be back as soon as we have a chance to talk to the neurosurgeon. But again, although it's not good news, I don't want you to get too pessimistic or discouraged. There's a lot we can do. Okay? Fair enough.
All right, thank you.
All right. Yeah. Right.
For the past 4 months, Dr. Rosenberg has been negotiating to obtain another experimental immune booster which may help patients like Donald Weber. The company that makes it delayed permission because they wanted the data related to the drug kept secret.
To protect the investment that they're making, they're insisting on secrecy and confidentiality, which is very much inhibiting the interchange of information among scientists. And so it's a very difficult, frustrating situation for scientists, and it needn't be this way. I sort of wish I could drag the lawyers onto our ward and let them meet Tina McDaniel and let them meet Sidney Wheat and Kathleen Helgens and see what it is we're trying to do and realize, in fact, that there's no room for keeping secrets when you're trying to help patients who are dying of this disease. How was the drive? Pretty nice? Good. Well, first off, all good news about the x-rays.
I worry about that.
Yeah, I know you do. One of the reasons I wanted to see it today, so you didn't have to continue worrying about it, we went over all the x-rays. We don't see anything on the x-rays, so that's terrific.
The only thing is I found 2 little bumps.
Yeah, I want to feel those. Now tell me what's happening. So you notice a
little bump right here and one right here.
Now, I understand they're coming and going. Is that?
That's the only 2 I've seen so far. And I don't know. I found them. I talked to you, what, about 10 days ago?
Have they been changing much?
No, they've been staying the same size. They come and they stay the same size. But the ones, remember all the ones on the cheek? I got one left and it's still going away, and these up here are still going away.
Remember all that tumor and melanoma that filled this whole side of the neck?
I probably had 102 of them. 100
What's
of
that?
them. Probably had between 100 and 200 spots.
In this area, boy, that's just continuing to fade down here, isn't it?
Yeah.
See, all these flat areas, my guess is, don't represent melanoma at all anymore. And this whole area is cleared off. You know, if we were to show that photograph of your neck when we started, boy, what a difference.
I'm just wondering why the 2 little bumps come back.
Yes, well, you know, that could be, it could be a little melanoma that's still there. We can't really tell, but I would say 99% of it is gone.
Yeah, I would too.
The response rates we're seeing, almost half of the patients responding, is very exciting, but it still means that half of the patients are not responding, and the question is why. And one of the possibilities is that the tumor is escaping our treatment because it stops expressing the particular antigen that we're immunizing against. And if it doesn't express that target, of course, the immune system can't destroy it. You see, tumors as they grow are constantly changing and mutating. And if they change in such a way that they no longer express the GP100 peptide, then our immunization will not work.
Sidney Wheat's 2 remaining lumps are removed. They show he still has active melanoma.
Right.
Could his cancer be mutating and escaping the vaccine?
To the positive one, and then we'll go
Using a special stain that shows up any cells that are responding to the vaccine, Dr. Rosenberg compares slides.
So here is Sidney's tumor right at the start of treatment, and there are many of the cells that are suitable targets, and when we immunize, presumably, we can wipe these cells out.
The brown-colored cells show that Sidney's melanoma has the peptide on its surface.
But now the last biopsy, after the end of treatment, let's take a look at it. Now you can see that none of the cells actually have the antigen on them. It looks like this tumor may have, this is hypothesis, may have escaped the treatment because some of the cells are not expressing the antigen and they have been able to grow.
After surgery, Sidney is cancer-free. If his melanoma reappears, he'll be given a new vaccine the team hope will outwit the mutating tumor.
We're about to start a new trial in which we immunize simultaneously with 4 different peptides on 3 completely different proteins, so that we give the cancer cell far less of a chance to escape from our treatment. And just as is the case when one can use multiple approaches against AIDS or in chemotherapy, against multiple targets on an offending organism, one can do a lot better than when you attack just one.
Arms up over your head, please.
Jacintha Cohen is back for review with her daughter Maria. She's received 8 doses of the vaccine plus IL-2.
Cohen, hi.
The crew.
Hi. Good. Well, first off, perfect news about the x-rays.
Wonderful.
Everything is completely fine. No, we didn't see any evidence of any tumor anywhere, so that's wonderful. Wonderful.
I've read them all. See, he's just looking for bumps and stuff right now.
Everything feels good.
Like underneath.
Just looking at what we call lymph nodes, Maria, just to see, but everything feels perfectly normal. How about some of these areas here? Any of them?
Just
They're still getting lighter, aren't they?
Just lighter. Absolutely.
Really? Isn't that wonderful?
I know.
These were so prominent. You know, we have the
that was my
photos of
worst.
them. Yes. Good. Isn't that wonderful?
All right.
Good.
Good.
We'll
Good
be
news.
back.
Thank you. Should bring you with me all the time.
I'm good luck.
That's right. You are. You are good luck. Well, did you get good news?
8 months into the trial, nearly half the patients are seeing their cancer shrink dramatically. Is it just a fluke or major progress in the treatment of melanoma?
We're cancer-free. See you in 2 months.
The National Cancer Institute is anxious to have these vaccines evaluated at other institutions as well, so more patients can be treated. And there are institutions that have expertise in immunology and can do the kinds of assays and have the kind of experience that are required. And so right now, the peptides have been produced and vialed under the kinds of conditions that will enable them to be shipped to other universities in this country.
Research hospitals will soon be testing the vaccine on hundreds of patients. If their results confirm Rosenberg's data, the new treatment could be available to all melanoma patients within 2 to 3 years. A 10th gene has just been found, which may enable them to treat other kinds of cancers as well.
The reason we're so particularly interested in this gene is for the first time, Rong Fu has come up with a gene that's expressed not only on melanomas, but a third of breast cancers and some prostate and ovarian cancers, so that although we've been able to study patients with melanoma, now for the first time we might be able to begin extending this to patients with other kinds of tumors. So it opens up a whole new horizon for us.
Donald Weber had surgery to remove his brain lesion 1 month ago. This return trip will confirm whether or not the operation was a success.
I'm just waiting for my CAT scan. Drinking my wonderful contrast fluid.
I'm sorry.
And wondering what I'm going to find.
Are these all of his brain x-rays?
No, we just have the GATA.
Just have put out the gadolinium? Hi, Nick. Good. This is Dr. Weber, who has had a response to treatment, but then developed a brain metastasis, which we resected in June. And this is his follow-up scan. So we're quite anxious about whether or not he's developing any recurrent brain disease.
There is no residual or recurrent tumor, and the rest of the brain is also.
Okay, so you see nothing new?
Free of disease, yes. I don't see any disease, just the post-operative changes.
Well, we've had a chance to look at all the x-rays. Let me tell you where we stand. First off, the brain, normal.
Well,
normal. We have no evidence of anything going on in the brain at all. We see the area where you had the surgery. It looks like it's very well healed, and that's wonderful news. So it's entirely conceivable. It's the only one there. We have some patients where we've resected a single metastasis from the brain, and 6, 7 years later, never seen anything. So, and we know our immunotherapy was doing battle with this, so that's good news. It's clear you've had a very dramatic response to this treatment.
with disappearance of lesions in the lung and under the arm. It was much, much smaller when we finally took it out. So there's no question your body's doing battle against this with the vaccine. Good news. Good. We'll be back in just a minute. Sure.
Thank you very much.
Uh-huh. Right now, you may never have any further trouble with this, and you just need to go on and do what you normally do. Now, we have no further treatment planned right now. What we'd like to do is see you about every 2 months with repeat X-rays and just follow things along. We have a lot of new things that we're doing. Hopefully, you'll never need anything that we do, and everything we do for you will be not relevant. But should we ever see any growth of this, we'll have other things to do.
You have another gun for it.
We have, and hopefully it'll be more than a gun. It'll be a cannon.
The results of Dr. Rosenberg's peptide vaccine plus IL-2 trial show a 42% response. It more than doubles previous response rates for melanoma patients and is conclusive evidence that cancer vaccines can work. The world may soon have a new weapon in the war on cancer.
The immune system has the wisdom and the power to cause the destruction of large tumor burdens in patients. And if we can just learn how it works, I think we can extend it to a far larger number of patients with a wide variety of cancer. So, am I optimistic? Yes.